LinkedIn family. Welcome to another episode of our mini-series, Coffee with Capital RX. I'm one of your co-hosts, Chelsea Pfeiffer, and our other co-host, Laura Francis, today will be interviewing Sara Izadi. So welcome. She is our Senior Vice President of Pharmacy Services here at Capital RX, and we are going to get all of her clinical perspective and pharmacy insights on what is most important for our plan sponsors and our brokers. So, Sara, you oversee everything from formulary management to utilization to clinical programs, amongst other areas.
That's right. Thanks, Chelsea, for the introduction, and happy to be here.
Great. So let's get started with question number one. So what clinical or formulary programs do you think have the most financial impact for plan sponsors?
Great question. So imagine the clinical ecosystem as a triangle. Cost savings is largely achieved from interventions at both the apex and the base of the triangle. At the apex of the triangle, you have high-touch programs that touch the least number of members, but those who need it the most. These are your members with complex conditions who are oftentimes perhaps even utilizing a specialty medication. Programs here are centered around case management and removing the barriers to adherence. At the base of your triangle, you have your formulary that is far-reaching, and this really touches every utilizing member. Cost savings here is achieved from formulary strategy and utilization management edits, including step quantity limits, and most notably prior authorization or PA.
Great. Okay, so PA has been coming up a lot. It's increasingly getting more attention from plan sponsors and from brokers. And there's a lot more interest going into some of the questions of, do we have the right PA criteria put in place? And then who's monitoring adherence? So are those questions equally important?
Absolutely. It is important to have PA criteria in place, obviously, and truthfully, most organizations do. But it is important to ensure that criteria is being followed appropriately. Plan sponsors should ask some really significant questions, and they should be centered around auto approvals and the types of clinicians who review and approve prior authorization requests.
So let's dive into question number two. So how often should plan sponsors evaluate implementing utilization management and clinical programs throughout the lifespan of their contract? Now, I know there's a big emphasis and push when a client is being implemented, but what about after?
Laura, PBMs should constantly evaluate their clients' utilization to identify opportunities where clinical strategies can create cost savings both to plan sponsors as well as members. There is no one-size-fits-all approach to clinical management. So our team focuses on a tailored solution that is presented to the clients at least quarterly.
Okay, no, that's great. And Sara, I would imagine that a consistent review of utilization helps plan sponsors stay in tune, with their benefit arrangement and its performance. So I appreciate your time and insight.
Thank you for having me.
Yes, we're so grateful that you were able to come on here and give some clinical perspective on some of the topics that really do impact plan sponsors and the brokers. So for everyone, thank you. That's our show for today. And we also just wanted to mention, we are looking forward to engaging with you as our audience. So please comment any questions that you have for our clinical team below, and we will get to those. But we also want some topic submissions for our next upcoming episodes, and we will be picking those at random. The ones that are picked will actually win a prize. So thank you all from Capital RX. We'll see you next time.